Our group did evaluate the relationship between mental health and abortion. We were very interested in seeing if there was any correlation between them. So my name is Kennedy Brakefield.
My name's Mia Ballos.
My name's Jamesia Crawford.
My name is Catherine Elam.
My name is Paige Jodis.
And my name is Lexi Orpiza.
And we're going to be telling you about our research.
So first is the background. Abortions have become a controversial topic in today's society. The Centers for Disease Control had reported over 900,000 legally induced abortions in 2019. One major thing that has kept this topic very prevalent is the ongoing debate surrounding pro-life and pro-choice. So basically, if a person is pro-choice, they support the notion of allowing the mother the choice in terminating the pregnancy or keeping it. And if a portion of society is pro-life, they support the idea of the mother not being allowed to terminate the pregnancy at all.
There are really strong articles surrounding the physiological aspects of abortions, but there are very little research about what has been done regarding the physiological effects of abortions on mental health of the women who have had one. While abortions have a physical effect on the women's body, their mental health is something that should be taken into more consideration. A few mental health concerns can be depression, suicide, anxiety, as well as substance abuse, which can be alcohol abuse and illicit drug use. As more research is done around mental health and abortion, more can be understood on the long-term effects of abortion on women.
So our PCOT and purpose. Our group's PCOT question was, are women who have an abortion at an increased risk for mental health concerns compared to the women who never had an abortion at any age in their life? So mental health has been rising concern in communities as well as the medical field. With abortions already being risky, it's intriguing to know if the procedure has possible long-term effects on the women's mental health, such as if abortions can lead to an increased risk of developing depression, also if they could lead to a risk of substance abuse, or even a lack of knowledge on abortion procedure affecting overall mental health in these women.
Some key words used by the group to conduct the literature search were abortion, infertility, fertility, mental health, depression, reproductive outcome, sterility, long-term effects, embryo, uterus, women, and early termination. Inclusion criteria included women who had undergone a voluntary termination of pregnancy, while exclusion criteria included women who had a history of sexual trauma, mental health disorders, and drug or alcohol abuse.
So when we reviewed our literature, we were able to see that all of the women evaluated for mental health concerns were able to give feedback on their mental health and potential substance abuse regarding the circumstances following an abortion. Some of the common themes found amongst the women evaluated included depression, anxiety, substance abuse, loneliness, and grief, with the three most common being the presence of depression, anxiety, and grief. From our literature, approximately 66.7% of our articles supported our PCOT are women who have an abortion at an increased risk for mental health concerns compared to women who never had an abortion at any age in their life. A study by Solons from 2019 revealed that there was a 43% increased risk of depression, anxiety, and suicidal ideation among women who received an abortion compared to those who had not. Another study revealed that women who received an abortion experienced higher anxiety scores at all 4 interviews compared to women who had a miscarriage. In addition, another study revealed that the results in the study showed that mental health scores were found to be higher for depressive symptoms in women who had an abortion within the past 6 months. Another study, when we were researching, had different assessments that revealed the woman had scored high on the models and had elevated levels of anxiety, depression, PTSD, and feelings of wanting to be pregnant. This researcher highlighted how many of these women felt they lacked knowledge in the procedure pre-abortion and they had received counseling before and after the procedure that might have affected their mental health. On the other hand, another study from our literature review revealed that women who were denied an abortion experienced higher rates of anxiety, lower self-esteem, and lower life satisfaction compared to those who underwent an abortion. Another study denied a parallelism between abortion and higher rates of depression and anxiety after a self-inventory questionnaire. Overall, a large majority of the literature we reviewed supported a correlation between abortion and increased mental health concerns.
Overall, the result was that women who have had an abortion are more at risk for increased mental health concerns. While some women do not suffer from mental health issues long term from an abortion, the first weeks to months after one, there is an increase in anxiety and depression on average. Nurses can help support patients who have mental health issues. They can use language that shows consideration, can be empathetic towards the patient, provide sensitive patient care, and give the patient options that they can take advantage of to seek help or if they need support groups. As a nurse, it is important to be there for the patient in any way we can.